Hi there, it's me, April Watts with Magic 95.9, Baltimore's best variety of R&B. Welcome to Facebook Live with GBMC. Today, well actually this month is Lung Cancer Awareness Month, and so we are going to talk today about smoking and how to quit smoking and lung cancer screening. And joining me to do all of this is the expert, the amazing Dr. Joi Johnson-Weaver, family medicine physician at GBMC Owings Mills. How are you?
Oh, I'm doing fine. Thank you.
Thank you. So let's get right into it because a lot of people have a lot of questions. People were very interested ahead of time, so that's a really good thing. What is wrong with smoking?
Well, smoking's terrible for you. There are a lot of problems that it can cause. A lot of times I like to talk to patients and say, hey, let's go from head to toe and say what it can do. One, it's terrible for your skin. It ages you. Two,
We don't want that.
We don't want
No,
that
we
at
don't.
all. It can affect your eyes, so your vision down the line. It can cause oral cancer. It can cause throat cancer. It can start to decrease the density of your bones, so you can have early osteoporosis. It can cause lung cancer, which is, a big topic this month, of course, with screening for lung cancer. It can cause heart disease as well, so it can accelerate your risk of atherosclerosis and cause heart attack. And it can cause bladder cancer, and really the list keeps going. So This is a lot of damage to your body.
Yes, and there are some people who believe that anything in moderation is okay. So what if a person only smokes a couple of cigarettes a day? Is that as bad as smoking more than a pack a day?
Well, certainly if you're smoking a pack a day for a long number of days, months, years, it's worse than, hey, I have an occasional cigarette when I go out to the bar with my buddies. Less than 10 cigarettes a day is considered a light smoker. A pack a day is considered a heavy smoker, and there are a lot of heavy smokers. But I would still say any smoking causes changes to your body, the things that I was talking about. So even though they may cause those changes minimally, they still are. And so I would say no smoking is still the best.
And we just want to let you know that this is an interactive conversation. So if you're watching and you have a question, please feel free to leave it in the comment section, and we'll get to your questions as well. How significant of a health issue is lung cancer in the United States? Because it doesn't get talked about as much as breast cancer.
Sure. Well, lung cancer is responsible, one of the top cancers among men and women, causing about 1.5 million deaths per year.
Wow.
So it's pretty significant if you look at all cancers.
Do all clinicians talk to their patients about smoking, or is it something that just has to come up if there is an issue?
It's a great question. I think in primary care, it really, obviously our goal is prevention. So we ask all those sticky social questions, and we ask, are you smoking? That's definitely one of them. And so if you see that, that's a flag. It's something that we've got to talk more about, and if I have a new patient who comes to me and they're a smoker, it's definitely something we're going to talk about. At the end of every visit, you like to kind of go over what your risks are for things happening down the line. And I let them know, hey, if you keep smoking, these are some of the things that can happen, some of the things we talked about just a few minutes ago. So it's definitely something that we talk about. And then the next step is, hey, are you thinking about quitting? Has it ever been a thought?
Right.
If you've quit, why are you smoking again? If you're thinking about quitting, what are you thinking of doing? And then that tends to lead into a lot more questions and maybe even a treatment plan.
Okay. Well, it's easy to say people should not be smoking, but we all know that smoking is an addiction. So what are some successful ways to stop smoking?
There are different ways out there, and it is not easy, and that's why we do, again, primary care, I push prevention. So it would be great to get you to stop smoking, or if I catch a young person smoking early, I'd love to get them to stop before they're truly addicted. But then we have those, 30, 40 somethings who's been smoking for even only almost 20 years.
Yeah.
And so we really have to start talking about the different ways to stop. Some ways to stop are giving them a little bit of nicotine each day, and like the patch. A lot of people have heard about the patch, where it gives you a little bit of nicotine each day, but it's stepping down the dose, so you're kind of weaning yourself off, trying to cut down those cravings. Of course, the cravings are still there, but it at least decreases them to give you your best chance of really quitting. There's the patch, there's the gum, and there's a few other smoking aids. But then we talk about some medications, so some oral medications. Chantix is a big one that's on the market. Wellbutrin is another one that's been around for quite a bit of time. I've had a lot of success with Chantix, and so it's definitely something that I bring up right away with patients. So those are some of the most common ways. And also some people say, I don't want anything with nicotine replacement. I don't want any pills. So we talk about a support system. Okay, who else smokes in your house? Okay. Because if your partner smokes, it's going to be really tough to stop. We talk about what things trigger you wanting to smoke. If you have an alcoholic drink, if you've had a stressful day, okay, so let's address what you do with stress, and that's a big one. So, and then we talk about, well, who can support you? And there's a hotline that people could call, and it could help with that as well.
Good stuff. Well, there's some different alternatives. And speaking of alternatives, some people believe in hypnosis as a method to help stop smoking. What do you think about that?
Honestly, I think if it's not going to hurt you and you have some faith in it, then go for it. Go try it. I can't imagine that hypnosis is going to have some kind of harmful effect. And a lot of times things work when you have a strong belief that it's going to work. Right. So if you're going in this and aunt and your sister and other people have told you this is going to work and you're like, yes, this could work, then by all means, you can try it. Certainly there haven't been a ton of studies that tell us, hey, hypnosis is a great alternative. But again, if you think it's going to work and you're willing to try, then I would do it. Okay. Yeah.
Now, the person is asking, can you screen for lung cancer? So I think that they're asking, can you specifically, as a family medicine physician, screen for lung cancer?
Well, so screening for lung cancer, there are some guidelines that have been around for a little bit, which have talked about a certain age group being screened. And the age group is 55 to 80. If you've had a 30-pack year history of smoking, you can get a low-dose CAT scan, and now it's been approved by a lot of organizations, and so your insurances should cover it, where you get a low-dose CAT scan every year to screen. It started off with, well, I smoke, doc, can you just give me an x-ray once in a while to make sure my lungs look okay? Oh, wow. But we found out the x-rays, one, we're exposing you to radiation, and two, they're not that great for really picking up lung cancer. We'll miss a lot more before we actually have benefit to catching cancers. So then the thought was, well, let's do a CAT scan. A CAT scan is a lot of radiation. So now this is somewhere kind of in between. So it's low-dose CAT scan, trying to catch those cancers. There are some pitfalls to it, so I do say definitely have the discussion with your doctor as an individual to say, hey, is this right for me? But it is good to know that there is some screening opportunities out there.
Now, Doug wants to know, does this mean that patients who fit all of the above or any one of the above criteria qualify to be screened?
Sure. So I guess if you think about this, and say you were a young smoker, you started at a young teen and you had 30 pack years, could you get it before 55? Right. The guidelines really are that 55 to 80 group. So you don't quite fall in. But again, this is where we're talking about having that discussion with your doctor. And of course, as primary care, always pushing prevention, always pushing you seeing a doctor regularly, that, they should see that you've been smoking that long and say, okay, well, we need to say, even though you're not fitting in that age range, maybe we consider some kind of screening.
Okay, so Doug is within the age range, but he said that he's never been a smoker.
Oh, I got it. So no, we are not getting low-dose CAT scans on everyone 55 to 80, certainly. Okay. So your risk for lung cancer comes from the smoking itself. And even if you have secondhand smoke exposure, it's bad. You don't want to be around a smoker constantly, but your risk is much, much lower of having lung cancer.
Okay. Yeah. Well, I have a personal question because both my mother and my grandmother passed away from lung cancer. I am not a smoker, never been a smoker, but I'm wondering, is it hereditary? Because my grandmother smoked, but she had stopped smoking for decades, prior. Right. But she still got lung cancer. My mom was a pack-a-day smoker, and what happened was the cost of cigarettes went up. And my mom was a very frugal woman. And she said, I'm not paying that much for cigarettes. I'm going to go the whole weekend, and I'm not buying any cigarettes. So she went the whole weekend, she didn't smoke. She said, okay, well, I went the weekend, I can go the week. I can go the month. So 6 years went by. And then she developed lung cancer and passed away from it. And both of their lung cancer spread through their body in the exact same way. And so even though I don't smoke and I've never smoked, I'm fearful that maybe there's something hereditary going on. What would you suggest?
Absolutely. So when you look at lung cancer, 90% of lung cancer is because of smoking. Okay. There's a small percent to like environmental exposure, asbestos, things like that. There's an even smaller percent that deals with the genetics.
Okay.
So what the question you're asking, and first of all, kudos to both grandmom and mom for stopping smoking.
Yes.
But there is a risk even once you stop. So you've already had some changes to your lungs. You've already had the components of the cigarette and the smoke drop those carcinogens in your lungs and start some changes. So you might not still be able to avoid it. I do tell people, once you stop, your lungs start to try to repair themselves. And so you are significantly decreasing your risk, but there's not a no risk. You still don't go back to the normal population of non-smokers. So both mom and grandmom probably still got it from smoking, right? That's what the numbers tell us. But there is a small genetic component, and it's worthy of kind of maybe digging in the family history, seeing if maybe there were some other people who had lung cancer, and talking to your doctor a little bit just to see, hey, is there any possibility that there could be some genetics here?
All right, good stuff. Now, some people choose vaping, and they think that it's a safe alternative to smoking. Is it?
That's great. There's not, right now, because vaping has come on the scene, now we have to rush to kind of figure out, okay, is this safe? Is it not? And most studies are done long term, right? So we don't have tons of data right now. What we can say is we're a little nervous about it because we don't know enough about what's truly in this smoke that you're inhaling. So am I going to tell a patient it's absolutely safe? I can't say that. It's not all regulated. We don't know. If there's nicotine in it, well, we already know nicotine still causes that addiction. We don't want anything giving you an addiction. So we try to avoid that. But I will say anecdotally, meaning I just have a few patients where they've turned to vaping and stopped smoking. Where I've had one patient who smoked 40 years, 40-pack year history.
Wow.
And she knew she was never going to stop smoking. Always smelled like smoke. Probably had a lot of complications from smoking. And she stopped with vaping. So it's hard for me to just throw down like the gauntlet and say, hey, no vaping. If it can stop you from smoking, I probably would say, hey, that's better. I just can't tell you 100%, hey, there's not something else that could happen with vaping.
Okay. Now, with the legalization of marijuana, like spreading across the country, what about marijuana? Does that cause lung cancer?
This is always a question. And this is a little inconclusive as well. It hasn't been legal long enough and in large enough for us to do large enough studies to really truly see what marijuana does on the lungs. There have been studies, and they can't truly say, hey, it's linked to lung cancer. But I do say this to most of my patients who smoke marijuana. Marijuana does a whole lot of other bad things to you, and it's still smoke. So even if we're not saying it causes cancer, one thing I didn't talk about with smoking is before cancer, there's still the wheezing, the recurrent respiratory infections. And marijuana, by all means, definitely does those things. So even if right now marijuana smokers are in the clear for lung cancer, because we just don't fully know, there's still a lot of side effects to smoking, period.
That makes sense. We have another question that says, if I grew up with someone who smoked, how often should I get screened for lung cancer?
And that's a great question. I think we touched upon it just a little bit before. Secondhand smoke is bad, especially, again, if you have that spouse that you're by for 30 years who's smoking a pack a day, this is the conversation you have with your doctor. It's a little different than people come over and have a party at my house once a week and smoke. So your exposure is a lot less. I think this is definitely more an individual question where you have to sit and talk with your doctor. But we do know overall your risk is less, but you do want to let your doctor know, hey, there's secondhand smoke. What should I be thinking about?
Now, I remember when I was growing up, there used to be commercials, the no smoking commercials, and they talked about how secondhand smoke is actually worse than firsthand smoke. Is that true?
Yeah, I'm going to say no there. I don't think that the secondhand smoke is worse. I definitely think that there's a higher risk than the person who's not around a smoker. And certainly there's some cases you could probably pull up of people having lung cancer because of secondhand smoke.
Right.
But there's no great screening right now, no screening guidelines for that. So this is, again, an individual question. But it is something to bring up. I mean, when you're talking to your doctor, you want to talk about your exposures.
Okay. We have a lengthy question from Heather, and I'm going to try to read it slowly. My father was diagnosed with non-small cell lung cancer, which was discovered during a pre-op chest x-ray for gallbladder surgery. He never smoked and only rare social alcohol. Please let me know if there's value in having routine screening chest x-rays or in continuing to have pre-op chest x-rays.
Okay, so x-rays, and this is how the whole screening guidelines came again. So that screening guideline of, hey, if you're smoking 30-pack year history, that means a pack per day for 30 years, and you're in that range, 55 to 80, you talk to your doctor about the benefits and risk of getting a low-dose CAT scan. The x-ray is not a great screening test for lung cancer. Right. So that was incidentally found, meaning they weren't looking for it, they found it. But if we took 20 more people, are we really going to really catch, and 10 of them have cancer, are we really going to catch cancer in those 10? We don't think so. That we won't catch as many. We don't think the x-ray is a great test. So the pre-op x-ray, it's done for more than just cancer. You know, they're looking, of course, for, you know, even basic infection and things like that. The pre-op chest x-ray is still done. But again, yeah, it's still done in certain cases, but it is not a screening test for cancer, for lung cancer.
Okay.
Yeah.
Yeah. Do we have any questions from the viewers?
We do. We had a question from Vicky. Vicky asks, does hookah smoking cause cancer?
That's a good question because I don't smoke, but I do occasionally smoke hookah.
Now, I'm pretty sure it still has nicotine though, the hookah does, right? So when I tell people, again, we're talking about nicotine, addictive potential, that's something that I don't necessarily, I'm not a proponent of.
Okay.
And I think that any smoke has carcinogens, right? They're dropping chemicals in your lungs. So we can't say you're free and clear when you're smoking hookah.
Bye-bye hookah. Bye-bye for me. See you later.
We do have another question. This one's from Laura. She says, most people already know that smoking is bad for your health, but many people do it anyway. And are there any other reasons that you can give to encourage people to stop smoking?
I think health first. So you're really loving yourself and loving your body. I'd like to say that is a huge reason to stop smoking. But maybe you can spread it and say, hey, to people around you. So if you're a smoker and you have children, we know that can actually cause respiratory infections in children. And if your child has asthma or allergies, which can kick off asthma-like symptoms, that really can do it. And there's a lot of people who think, well, I smoke, but I don't smoke in the house. But we know that smoke clings to you, it clings to your clothes, and so you're still bringing that allergen into a house and a home. So maybe if you don't want to take that ownership for yourself and say, hey, I really want to stay healthy, then maybe for others around you. I mean, now you can go to a lot of campuses where they say, hey, it's smoke-free. Hospital, you can't smoke outside, so everyone walks through a cloud of smoke as they're coming out. Because you can still get it on you and all of that. So there's reasons for that. So we're doing this, for your own best health, but also others around you.
And for vanity's sake, and you can correct me if I'm wrong, someone told me that if you're a smoker and you're a regular smoker, the motion that you have to do to pucker on the cigarette causes wrinkles in your lips. So if you're vain, you might not want to do that.
Sure, because we talked about the skin changes. And I can tell you, if you take a 40-year-old smoker and sit them by a 40-year-old non-smoker, someone who's heavily smoking, you can see the difference in the aging process. It's pretty apparent. So.
We do have another question from Greg, and he wants to know, how long do you think it will take let me start again. How long will it take for us to understand the impact of vaping?
That's a tough one. I think, again, it'll probably take some time. And also what it'll take is everything being regulated. And I think that's why some people like it. It's sort of this, hey, I don't want anything regulated by, different organizations. But I do think that's just going to take some time. I just tell everyone, again, with vaping, just use it with caution. One other side note that people don't realize is some people aren't using it to come off of smoking. Some kids are using it because they think it's cool. So it's like, I'm not smoking, I'm vaping. But that's kind of a gateway to those sort of those sort of just practices of lifting something to your mouth,
Yeah.
watching the smoke billowing out, that kind of coolness. And so that scares us too, because maybe some child, some teen who wasn't even going to smoke at all is now, I like this, oh, why not have a cigarette at some point? So, you know, I think people really have to think through some of the ill effects of things.
All right.
The questions
If we don't have any more questions, then this was very informative. Thank you so very much. And this is a topic that's near and dear to my heart. So I appreciate the work that you're doing. Once again, that's Dr. Joi Johnson-Weaver, and she is a family medicine physician at GBMC Owings Mills. You guys are doing like amazing work. So thank you.
Great. Thank you so much.
And our next Facebook Live will be December 21st at 3:15 p.m. We'll be right back here. So we'll see you next month.